Good evening, I'm John Yang. There were 12 seasonal flu-related deaths of children this week, according to the CDC. That brings the total number of pediatric flu deaths this season to 216. That's the most in 15 years, and the flu season isn't even over yet. Experts say one reason for this new record could be the plummeting flu vaccination rate for American children. It went from 64% 5 years ago to 49% this season. And this week, Health and Human Services Secretary Robert F. Kennedy Jr. announced plans for new safety testing requirements for vaccines. That could delay the availability of new vaccines, including a COVID booster for this fall. Virologist Dr. Peter Hotez is at the Baylor College of Medicine. Dr. Hotez, there's a lot I want to talk to you about, but let's start with that new record for pediatric flu deaths this season. What do you make of that?
Well, I think it probably is related to the decline in immunization, since most pediatric influenza deaths occur among the unvaccinated, like most of the other viral infections that we've been seeing. But remember the context of this. This is on top of fourfold rise in measles outbreaks over the last year, even before what was going on with this current major epidemic, a sixfold rise in pertussis cases. So the big picture is we're going the wrong direction in terms of children not getting the vaccines that they should be getting.
Is this a holdover from the vaccination hesitancy that emerged during the COVID pandemic?
It very well might be. There's been some Gallup surveys and others that have shown that spillover effect, that the same parts of the country where adults were refusing to get COVID vaccines are now spilling over to childhood immunizations. So, for instance, in West Texas, which had some of the lowest COVID vaccination rates in the country, guess what? That's where we have our ginormous measles epidemic right now in West Texas and the Panhandle, and it's going up into the conservative rural areas of the Great Plains where COVID vaccinations were also low. So I think the big picture is there is that spillover effect from anti-vaccine activism that accelerated during COVID now into childhood immunizations.
Yeah, I know you've developed vaccines yourself. What do you make of what Secretary Kennedy said, that he wants to see new vaccines tested with placebos? What do you think of that?
This has been his playbook the last few weeks. Every few days he comes out with a new statement that misrepresents vaccine safety or effectiveness. For instance, he made it almost sound we don't routinely test vaccines against placebo control. In fact, just about all of the childhood immunizations historically have been tested against placebo controls, typically in randomized studies. So I don't really understand the basis of the new announcement, other than the fact that, when we do a randomized placebo-controlled trial for something like a COVID vaccine, we do it at the first time around. But as we're updating, because you're making minor adjustments in the composition of the vaccine to reflect new variants, we don't typically repeat the entire placebo randomized controlled trial because they're incredibly expensive and sometimes they're not doable given the size of what they are and the time it would take. So I hope he's not suggesting that we have to do an entirely new randomized placebo controlled trial every time we update a vaccine.
Is the effect of this to undermine confidence in vaccines, do you think?
Well, this is the bigger picture. Remember, what RFK Jr. has been saying every few days. First, he said the MMR vaccine was leaky, whatever that means. And when he talks about suggesting people get the MMR vaccine, he always often pairs it with a cocktail of useless interventions for preventing measles. Or he says that the measles hospitalizations are due to quarantine and isolation, which is not true. These kids are really, really sick. Now is the time the Department of Health and Human Services needs to be doubling down on telling the American people to vaccinate their kids and highlighting and emphasizing the safety and effectiveness of vaccines, not tearing it down. So I do think it's starting to have a very damaging effect.
Dr. Peter Hotez, thanks as always.
Thank you, John.
Thinking about selling your home? Start by comparing agents.
The measles outbreak continues to intensify throughout the U.S., including in Texas, where cases have spilled over the border into Mexico. As Jonathan Siri reports, it comes as researchers warn the country that it could potentially see millions of cases.
With summer vacation on the way for many, anxiety is high among travelers as the measles outbreak grows.
Always washing my hands after I'm going through security and touch all the bins.
The CDC is reporting nearly 900 confirmed cases in the U.S., triple the amount seen in all of 2024. And public health officials warn that's likely an undercount due to delays in state reports.
It's far more contagious than any virus that we know. And so on average, a person who has measles that exposes other people who are vulnerable will infect between 18 to 20 people.
Texas remains the epicenter of the outbreak, and infections are now spreading across the border, with cases in Mexico linked to the Lone Star State. Doctors there now making a big push for children to get vaccinated.
I bring them here so that they feel more protected, and if they do get measles, it doesn't hit them so hard.
Measles was declared eliminated in the U.S. in 2000, but a study published last week in the Journal of the American Medical Association finds the virus could become endemic, constantly present. Researchers say if vaccination rates decline by as little as 10%, the U.S. could see up to 11 million cases over the next 25 years.
Because the virus is so contagious, really population level immunity needs to be approaching 90 to 95% vaccinated.
The CDC says people who get the measles vaccine are protected for life and do not need a booster. In Atlanta, Jonathan Siri, Fox News.
Hello and welcome to The Excerpt. I'm Dana Taylor. As bird flu, also known as H5N1, continues to spread across the country, experts are concerned about the potential for undetected transfer and mutations. A new report from the Centers for Disease Control and Prevention, or CDC, suggests that Americans may even be walking around with bird flu and not know it. Are we ready for a bird flu pandemic? USA Today health reporter Adriana Rodriguez is here to share her reporting and tell us what she's hearing from health officials. Thanks for joining me, Adriana.
Thanks for having me.
First, what's the status of bird flu in America right now?
So far, we have reported nearly 70 cases of bird flu in people. 3 of them have been severe cases, so they've been hospitalized, and we've reported 1 death in Louisiana.
A recent CDC study found that bird flu may be spreading between people and cats more than previously thought. What was this study based on, and what are the ramifications here? How do cat owners guard against this kind of thing?
So the study is based on indoor cats where their owners were dairy farmers, and the data suggested that possibly the dairy farmers had brought the virus home and possibly infected the cats, although that wasn't quite confirmed because these workers were not tested. But I think what experts are most concerned about, besides, transmission between maybe animals and humans, is also the fact that it's the cats that are being infected. And the reason for that is because cats are a natural reservoir for both human and animal flus. So technically, a cat can have or be infected with both bird flu and human flu. And if that happens, then the bird flu virus could learn from the human flu virus and mutate accordingly. And that could make the virus, the bird flu virus, more dangerous and transmissible to humans.
As I mentioned, there's another study that suggests there could be asymptomatic infections. It sounds a lot like the COVID pandemic. How concerned are scientists about the possibility of that?
It does sound a lot like the COVID pandemic, and as a health reporter who first started the beat during the pandemic, it's the first thing I thought of too. So scientists definitely think that there is undetected virus out there because there's just not that widespread surveillance and testing that we had during the COVID pandemic. But at the same time, they don't think asymptomatic transmission is happening the way it did during the beginning of the pandemic. You know, it's not like people are transmitting between each other and then they go to a party and there's a super spreader event. Bird flu just doesn't transmit that easily between humans yet. So they don't think that's the case of what's happening. What might more be happening is that people are infected and they're experiencing very mild symptoms, so mild that they're not going to the doctor's office or getting testing. And so that's the undetected virus that we're not capturing.
Fired USDA workers were considered boots on the ground in the fight against bird flu. There have been reports that some of them have now been hired back. What's the latest here?
Communication with health agencies has been a little spotty lately. We haven't had any response to our request for updates. But basically what happened was that these federal workers were laid off on Valentine's Day, February 14th. And these workers were mostly working closely with the bird flu efforts and in food inspection and safety. So far, USDA said that they're working to rectify the situation and rescind these letters, but that's the update that we have so far.
Adriana, what effect are funding and staffing cuts having on overall efforts to monitor and control bird flu? There have been cuts at the NIH that affect research. Could it leave us vulnerable or caught unaware if there's a major uptick in cases?
Totally. I mean, any cuts to the NIH and to research grants and funding in general could drastically impact sort of the outcome of like how we are able to handle a global pandemic. And the thing is that when it comes to NIH research and grants, we don't know which studies are going to produce the next mRNA vaccines, you know, because even mRNA technology was basically brought on by years of NIH funding, not only in the technology itself, but also the science that sort of led up to that. So any sort of cuts to the studies that we're seeing come out of NIH could possibly affect our efforts in the future.
Who's most at risk of becoming infected with this virus?
So animal workers are usually most at risk of getting infected with this virus. Dairy cow workers or those who work with poultry, sometimes, those who work at the zoo or those who are, maybe at vet hospitals. Most of the reported cases have been among that population.
Adriana, you've reported on the creation of vaccines for bird flu. Is there a plan for them to be made available? What's the status?
So there was a promise for 10 million doses of stockpiled vaccines, and that's sort of, stockpiled at the national level from the federal government. We reached out to see what the status of that was, if we are on track to getting those vaccines, but we haven't heard back. But experts do say that these stockpiled vaccines should be enough to vaccinate those who are most vulnerable or those who work closely with infected animals or, animals that could get infected. The discussions that are happening now is when do we release those vaccines? So we have those vaccines stockpiled. Now, when is the best time to deploy them? And, some researchers say now, we should be vaccinating those who are most vulnerable and who are already working with these infected animals so that we can not only prevent animal to human transmission and protect these workers, but also to prevent the virus from continuing to mutate every time it transmits to a human host. But other people are saying, maybe we should wait until there's more cases among humans, deaths or hospitalizations. It's a moving target. The point is we do have stockpiled vaccines. The issue is, when do we get them out there?
Is a vaccination program for commercial poultry feasible here? Where do we stand with that option?
So there is a licensed vaccine for poultry, but the USDA has not authorized its use yet. And so it will take the USDA to authorize its use to be able to start vaccinating commercial poultry. That's a debated issue. Some people, say that it's a good idea to prevent transmission. Other people are also worried that when we export poultry, when we export meat, that other countries won't want meat that is vaccinated. So there's still a debate. And even though we do have a licensed vaccine, it's unclear if the USDA will authorize its use.
Turkey is sending the U.S. 33 million pounds of eggs due to the shortage here. How is bird flu hitting the economy generally, and which states' economies have been hit hardest from this disruption?
Eggs are definitely the hardest hit when it comes to bird flu. Bird flu had basically resulted in millions of egg-laying hens being killed to prevent further spread. And so there's less hens laying eggs, there's less eggs, and there is that shortage crisis that we have there. Plus, that shortage then also contributes to rising egg prices, and consumer behavior is also contributing to that, because everybody knows that there's an egg shortage and they're running to the supermarket to stock up on eggs, much like we did for toilet paper during the COVID pandemic. And that's further exacerbating the egg shortage and pricing issue. This is probably affecting our top sort of egg producing states like Iowa. Right now, milk is not having that same effect. We're not seeing sort of that price issue with milk because that is controlled at a federal level. But I'm sure that it could also hurt dairy farmers in the long run, especially maybe those in California, because that's where most of the herds are being affected.
What can you share about the moves that the USDA is planning now to combat bird flu?
So the USDA has promised over $1 billion, or about $1 billion, to aid these bird flu efforts. This includes trying to alleviate the egg shortage, protecting food, trying to limit the spread in poultry. So that's where we're at so far.
Many university researchers have shared alarm over the appointment of Robert F. Kennedy Jr. as HHS Secretary. His critics say that Kennedy's longtime opposition to scientifically developed vaccines, for instance, risks harming public health, not improving it. How could this impact Americans if there is a bird flu pandemic?
Any anti-vaccine or vaccine-hesitant messaging could definitely harm public health strategy to try to do like a vaccination campaign like what we saw with COVID. Vaccination is one of the main pillars of public health in mitigating spread and protecting people from hospitalization and death. And any sort of messaging that, vaccine isn't the way to go would hurt that campaign. We've already seen this in conservative states. Certain health departments have decided not to endorse or to, promote vaccinations. And one health department said that they're not going to even provide COVID vaccines. So this could definitely have detrimental effects, not only to public health officials and their strategy in trying to mitigate this potential pandemic, but also with Americans' lives.
We appreciate you coming on the excerpt to share your reporting, Adriana.
Thank you for having me.
Thanks for watching. I'm Dana Taylor. I'll see you next time.